Hi, I'm Dr. Jimenez, and I'm an orthopedic surgeon with specialty training in hip and knee replacements. Specifically, I did a fellowship for 1 year where I worked under the tutelage of Dr. Joel Matta. He's a pioneer in what's considered the anterior approach hip replacement, and today I just want to explain to you what that means. So what I have here is a model that's going to help demonstrate what a standard hip replacement or a posterior based approach gets you and what an anterior based approach does. So here you have a pelvis where your spine would be here, legs are down here. These are all the muscles surrounding the hip, and this is the hip joint without any muscles. As you can see here, this hip is arthritic, meaning that it's lost its cartilage and it's developed some bone spurs on both sides here. Now, traditionally, some surgeons might use what's called a lateral-based or even a posterior-based surgery, where there's an incision near the buttock or on the side of the hip. In doing that, they're able to come through the muscle, kind of spread this open to get down to the next portion of your hip, where you reach what's called the short external rotators. Here, they have to cut the short external rotators off and detach them to get down to your hip. And so this leads to you needing what's called posterior hip precautions after that procedure. In the anterior approach surgery, I utilize an interval in front of the hip where I don't take any muscle off of your pelvis. Through this interval, I'm able to come between what's called the tensor fasciae lata, the sartorius, and the rectus femoris, and use a natural interval that you can be able to get in. Through this interval and an incision about this big, I'm able to get in there, take off the diseased portion of the hip, place an implant inside the bone, shave the bad portions of your joint out, and place another implant into your pelvis and put everything back together. The surgery takes anywhere from 40 minutes on up to an hour and a half, depending on the level of difficulty. And within a couple of hours after the surgery, you're up and walking. I'd say that a lot of my patients actually tell me that they leave the hospital feeling better than they did walking into the hospital. If you want to learn more, please visit us at www.jointpainortho.com or follow us on social media, Instagram, Facebook, YouTube, at Joint Pain Ortho.